Hi everyone, it's Emily Goodlad here, one of the SOMM tutors, and thought that we'd get in touch and just hope that you're all safe and well. As you can see, I'm badly in need of a haircut, but I think, like me, lots of you will be doing remote consultations now, and I just thought that it might be just a nice idea just to share some of the learning that I have had over the last 2 months when I've been doing remote consultations, either by phone or by video calls, or the various platforms that we've been using. Like up here with the NHS, we've been using NHS Near Me, but I know some of you have done it via Zoom or Skype or whatever. And there are just a few things that I've learned that have made my life a lot easier, and I feel that I've become a lot more competent as I've gone along with just a few tips. So you probably know them, but I just thought I'd share them with you just to touch base. So the first thing is about preparation. Really, make sure that it's a time slot that's suitable for you and for the patient, that you've got the right equipment. If you're doing a video consultation, then has the patient got a microphone and a camera? Have you got a working microphone and a camera on your computer or device? And is that camera movable? Because thinking about sometimes if you're trying to look at their lower limbs, their feet or whatever, it can be a little bit difficult. So lots of things to consider. I have learned that actually it's much better to do it on a computer with a patient than a phone, because if you're doing a video consultation and they get a message or a call, then it can interrupt your consultation. So it is easier if it's done on a computer. Again, if you can give them some information prior to the call to make sure that they're suitably dressed so that you can see their knee or their shoulder or whatever, that'll save you time on the call. Good lighting, and for me as a practitioner, having a fairly plain black background is suggested, because it's not too distracting for the patient when you're on the video call. I don't know if you're like me, and when you see all these people interviewed on the news via this medium, and they all seem to have bookcases behind them, and I'm desperately trying to read the titles of the books to learn more about them, and I forget to listen to what they're saying. So a plain background is less distracting. And then if they can be prepared with things like their list of medications they're taking and stuff, then that'll all save you time on the call, because this kind of medium is exhausting for the patient as well as you. So if you can reduce the time that you're actually on the call, then having all this information beforehand really does help. And then once you're on the call, you do your normal introductions. I know if you go through NHS Near Me, then for the patient to get into the waiting area, they have to put in their name and their date of birth. So they've already confirmed their identity, but that might not be the case if you're using a different platform. So it is just, especially if you've never met the patient before, just confirming their date of birth and name. And also if there's anyone else in the house, not just for confidentiality reasons, for you and them, so always make sure that you're in a secure environment, that no one can overhear the conversation that you're having, but for them as well, again for confidentiality, but also for safety. And I've learnt that over the last couple of months, because if you are demonstrating some exercises and getting them to do it and something happens, it is good to know that there is someone in the house or someone that you can contact for them. So having a next of kin's contact telephone number is very helpful as well. So I guess that's all the start of the call, the tips I can think for you. And then you'd start to take the history in your normal way with the normal questions that you'll ask, how can I help you? What are your expectations? And that's where, again, it's been learning for me with the way that patients describe where their symptoms are or their pain is, because many of us have got different definitions of where hip pain is, for example. So I found that it's quite helpful to use articles of clothing to help the patient tell you exactly where the pain is, because we could think of hip pain as around the groin, we could think it laterally over the trochanters, or we could think of it over the buttock. And so, for example, with a hip pain, asking the patient, imagine you have a pair of jeans on. So would you say your hip pain is more over if you had the hands in the front pockets of your jeans, your hands in the back pocket of jeans, or over the side seams of the jeans. And then that starts to give you an idea of where the pain or symptoms are. And then the upper limb, I use, like if you had a t-shirt on, would you describe that band as where the sleeve of the t-shirt would be? Or you can refer to it as the badge area of the arm. And then as you go down the limb, you can talk about the pinky or the little finger side of the hand and forearm, or the thumb side, because again, if you're on the phone, not necessarily the video they can show you, but if you're on the phone, it gives you an indication. It's an easier way to find out exactly where the symptoms are. So you take, as I said, the history in the normal way, so there's just a little couple of tips to help you with just them describing exactly where their symptoms are. And then the physical examination is more of a challenge. I have found it's not so difficult getting them to do the cervical movements and the upper limb movements, but if you start to go down to the lumbar spine or the lower limb, then they start having to move their camera around and their computer, then the signal drops on a video consultation, so you have to start again. So it can be more challenging, but again, describing them. But what I have found is, for me, using a doll like this has been amazing. So even for the upper limb, for example, you can bend the elbow like that, and you could do lateral rotation at the shoulder, or at the lower limb, you can ask them, you can demonstrate with this. So again, you're not getting down and lying on the floor and having to move your camera. So you can ask them about bending their knee, straightening their knee. Foot's a bit fixed on this one, but it's better than nothing for dorsiflexion and plantarflexion, so and even a straight leg raise. So I found this really helpful to help me demonstrate what I'm trying to achieve to get some of the physical markers from the examination, and also with the exercises as well. Again, rather than lying down on the floor on a mat, then I can demonstrate with the doll. And so that has helped. It's really difficult, well, impossible to do a full neurological examination over the phone, for example, the reflexes, but I have discussed with patients some of their muscle strength. So things like if they're sitting safely, you can get them to see if they can toe tap or they can heel raise. So you're getting some indication if you're worried of it, something like foot drop. You can ask them if they can sit to stand with one leg, again for quad strength. So you can do some of the myotomes, although it is a little challenging. So hopefully at the end of that, you've come to, I would call it more of a hypothesis of what's wrong with them rather than a clinical diagnosis. And you can start to pull together some clear plan in agreement with the patient about how you're going to be able to manage them remotely, or if you have picked up some red flags, which has happened to me over the last couple of months, who you're going to refer them to. So make sure you know what your pathways are for someone who you suspect has metastatic cord compression or cauda equina symptoms. We've got very good pathways here and very supportive neurosurgeons and oncologists who help us with all of that. So if you've excluded all of that, then it's perhaps sending them some exercise sheets, and the CSP has been amazing at resource for lots of information, or some infographics of patients like those as well. And then touching base with them to see how they're doing in a week or two's time, whatever your time scales are. So anyway, that's just a little synopsis of my experience and things that I've found helpful in my remote consultations. So even if there's one thing that helps you there, it might be the doll, or if you can't get a doll, this was from my local art and craft shop. I used a teddy bear to start with, but this has been the biggest help to me through this time. So stay safe and well, and we will be back in touch regarding how we're looking at our courses being delivered in a different way very soon. Stay safe, everyone. Bye.